Healthcare providers provide healthcare. Doctors, nurses, PAs, nurse practitioners, occupational therapists, speech therapists, dietitians, nutritionists, osteopathic physicians, chiropractors, the people who are on the front line seeing patients, rendering care, talking to patients and treating them. These are the healthcare providers that we need to be concerned about. And patients need to wake up and realize that the insurance that we call insurance today, it's not insurance at all. It's just a middleman. All it does is get between you and your provider of choice and try to provide some degree of leverage over prices, but at the same over your cost, but at the same time it completely destroys any sort of pricing that would help you get a better deal. And you look at what are the areas of our medical system where we've seen increasing quality and decreasing costs over the past 10 years. And if you look at where prices have actually gone down for medical services, it's things like LASIK eye surgery, it's elective cosmetic surgery. What do those things have in common? Well, they're not covered by insurance. You've got actually physicians and providers who are competing to try to take their procedures and improve them and make them more economical so people can actually afford to buy them. That's what we need. What we've gotten, what our federal government has passed with this health insurance mandate, not only has it mandated the purchase of a product that is inherently flawed because it's not insurance at all, but it's effectively made illegal in 2014 the health care plan that my family currently enjoys. You see, if you read Section 1302 of Obama and Pelosi's health care reform, what they've done is defined what allowable health care coverage will be. So there is actually a limit now on the maximum deductible for insurance plans. That's $2,000 for an individual, $4,000 for a family. So my $10,000 deductible catastrophic health care insurance, sorry, no longer an option. And furthermore, they've gone ahead and defined what constitutes an allowable health care plan as either, and this is funny, get a load of this, they've got a bronze plan, they've got a silver plan, a gold plan, and a platinum plan. Now, I'm a big fan of precious metals, but I don't think they belong in our healthcare system. And if you look at what's going on with a bronze plan, it's going to cover 60% of your expenses, silver 70, gold 80, platinum 90. This is just crazy stuff. Because when you start talking about a system that 5 years ago I could not afford, I couldn't afford a $20,000 premium for an 80-20 plan 5 years ago. Not only has the government said that I can't have my high deductible plan, they've also said that I'm no longer, that the insurance companies themselves can no longer exclude pre-existing conditions, and they can't do any medical underwriting. So let's think about that for a minute. And I think people are beginning to figure this out, what this plan is actually going to do to our healthcare financing system. Because if 5 years ago it was going to cost me $20,000 to buy a healthcare plan that provided 80-20 coverage, and now there is no ability for the insurance companies to eliminate people with pre-existing conditions, and they can't even do any medical underwriting, are premiums going to go down or are premiums going to go up? They're going to go up, right? So that this insurance is going to get more expensive. And what happens if I choose not to buy insurance at all, or if I just still can't afford it? Then I'll have to pay a penalty to our friends at the IRS. Who among here, who else thinks that we need to hire those 16,500 IRS agents to enforce this? Anyone? No? Okay, good idea. But yet they're going to tell us that we're going to pay this penalty. Well, that penalty, if you make $100,000 a year, it's only 2% of your adjusted gross income, so that's $2,000. So I can either pay more than $20,000 a year in premiums, or I can just pay $2,000 to the IRS, not buy any insurance. Then if I do need insurance, because pre-existing conditions have been excluded, well, then I'll just go buy insurance when I need it. Does that completely defeat the purpose? But I think, frankly, it's an intended consequence. This is not an unintended consequence. The goal here is to really destroy what system of private financing we have left. And we're putting more and more control into fewer and fewer hands instead of moving in the right direction, which is the direction of freedom. And it's incumbent upon us as conservatives to get the message out that what we need to do is not put all of our eggs into a basket that's currently broken, but to move in another direction. So my optimistic close here, because the good news, despite everything that Washington has tried to do, we are moving in a good direction. We have principled people in our North Carolina General Assembly today, our Republican caucus, that is working to eliminate and free us from this mandate to make it all the more easier to not purchase health insurance that we're not going to be able to afford, that's going to drive more of a wedge between doctors and providers. But the other thing we can really do right now is start talking with our physicians about the need and the imperative to start taking care of patients again. And I'm going to take an opportunity to direct people to our website, lawsonforcongress.com. Click on the Issues tab and read our section on healthcare, because we had a physician town hall about a month ago before the primary. And one of the panelists on our town hall was a Dr. Brian Forrest, who's right in my hometown of Apex. And Dr. Forrest is unique because 9 years ago, when he finished his family practice residency at Bowman Gray, he looked at the healthcare system as it existed and said, you know what, I don't want to play your game. I want to actually take care of my patients. What he came to realize over the course of his training, that he was being trained to see 30 to 35 patients per day just to stay in business. And he realized that that's not actually taking care of patients. That's not medicine. He's just running a factory, stamping billing codes on people's foreheads and trying to earn enough money to cover his overhead. And when he looked at the numbers and he began to realize that because doctors today, playing in this system of Medicare and Medicaid and private insurers and all of the reimbursement paperwork that goes on, it costs a physician's office $250,000 per year per provider in overhead just to play ball in this system. So when he left practice, he said, you know what, I'm going to operate a cash-only practice. He opened his practice on April Fool's Day 9 years ago because his colleagues in his residency program thought he was nuts. But today, he has a practice where he's full. He's got a patient census of 6,000 patients and a waiting list. But he is profitably seeing patients, scheduling 8 patients a day, plus leaving time for walk-ins. So instead of waiting for 50 minutes and seeing a doctor for 5 minutes, when you go to Dr. Forrest's practice, Access Healthcare, you wait for 5 minutes and you see your doctor for 50. Because it's about the doctor and it's about the patient. And he's providing care that is the best care money can buy. He loves to tell the story about looking into his waiting room and seeing two people next to each other. One person is a sculptor from Carborough who makes $5,000 in a good year in commissions, who's seeing Dr. Forrest because that's the best health care he can afford. That's the only health care he can afford. Right next to him is a retiree from Wilmington with a 130-foot yacht in the Wilmington Yacht Club, who's driving up there because he can't find anyone at any price who will spend an hour with him. But yet both of these people are getting the exact same quality care. And it's literally being given at 90% off what a typical practice would cost because the overhead is gone. So we can take our healthcare system back. It requires empowering patients and empowering providers and realizing that doctors exist to take care of patients. And to the extent that we rely on the government or rely on the insurance companies to set the rules and to limit our access to healthcare, that's moving in the wrong direction. I appreciate everyone's being here. I appreciate everyone standing for freedom, and I appreciate everyone's support in the coming general election as we work to defeat our 24-year incumbent David Price, who in addition to supporting this so-called healthcare reform, has supported cap and trade, has supported a so-called Food Safety Act, which is going to regulate our small farmers and local food producers out of business. There's so much to be concerned about in terms of how we're losing our freedoms, and it's great to see people standing up and realizing that the solutions to our problems do not come from Washington or even from Raleigh. They come from free people, free to do the right thing, right in our communities. Thank you very much.